Welcome. You're listening to the Louis Minor Show. I'm your host, Bell County Commissioner Louis Minor. Today is March 29th, 2025. We are back. Had a lot of stuff been going on that I want to catch you up on. And then I want to talk to you about some priorities for 2026. There's no Commissioners Court meeting on Monday because it's the fifth Monday of the month. So the next Commissioners Court will be April 7th. And I'm sure it'll be a lot on the agenda to cover, so I'll be anxious to talk about that once it comes out. But so let's talk about what's going on this weekend. Down in Austin, they're having an SDEC meeting. That's the executive committee for the Democratic Party. And because of Chair Hinojosa stepping down and resigning, we're going to be getting a new state party chair for the first time in 13 years. Since I've been involved with the Democratic Party, Chairman Hinojosa is the only chair that I've known. So I don't know who came before, but we will know who's going to come after. There's three people, top contenders at least, that are vying for it. And we'll play a clip here in a minute from the Texas Tribune where they're talking about that. But so that's just to cover the chairmanship until the state convention in 2026. And that's when we'll pick the state chair. This is only to fill a unexpired term because of the resignation. So that's going on tomorrow. Also, I'll be going to Houston to a Victory Fund champagne brunch. I've always been invited since being elected. And so this will be my third year going down to Houston and participating in that. It's a good group, good organization. Victory Fund trains and supports many LGBT candidates across the country and Texas. So I'm happy to be a part of Victory and excited for the champagne brunch this coming weekend. The next thing that I want to talk about is last weekend, the Texas Democratic Party and the Texas AFL-CIO in Killeen, we're in Killeen, for a workers' town hall. And it was a really great opportunity for people to come and speak and vent. They invited three congressmen, Carter, Pfluger, and Williams. Obviously, none of them showed up to answer to all these federal employees that have been terminated or, now they have to do 5 things, email and send it in, 5 things you've done this week. And it's scary if, you've put all your time into working and now working for the federal government because of the security and you're giving back to the country. A lot of them are veterans, but they're on the chopping block and they're under attack by this administration. And so we were able to gather, and I was surprised how many people showed up. I think probably around 150 to 200 people showed up. And that was simultaneously while there was another event going on in Belton for Indivisible put it on. But it was for another town hall for John Carter because John Carter hasn't held one in forever. And 100 people plus showed up to that one in Belton. So I think that will show you the motivation and the anger of the people here in Bell County, and why it's important to hold these things. Just yesterday, Beto O'Rourke and Governor Walz did one in Fort Bend County. They said thousands of people showed up to that on a wet, rainy night, Thursday night. So there's definitely a lot of anxiety, a lot of energy out there, and people are ready to do something. And I don't blame them. Cuts. You see cuts happening everywhere. And it's going to affect, it's already affecting infrastructure projects. It's going to affect our most vulnerable people through Medicaid cuts, through SNAP cuts. And that's going to fall on local jurisdictions, local taxing authorities, the counties, the cities, to meet that need. Because those people are going to be here in our community, and they're going to need help. And we got to be there to help them, because that's the right thing to do. So anyways, let's get back to the Workers' Town Hall. What I want to play for you is the Vice President for AFGE District 8, Miss Cheryl Aliano. She lives here in Harker Heights, Bell County, resident, and she gave a great speech. So let me pull that up for you so you can hear part of it. So with that said, I want to introduce the Regional Vice President, or Vice President of AFGE, Ms. Cheryl Aliano.
Good afternoon. All right. I am Cheryl Aliano, and I am the National Vice President of District 10 for the American Federation of Government Employees.
Excuse me. I need to turn up the volume.
We have a couple of people up here that are going to speak to you that are directly impacted by what is happening to our federal workers. And all of you sitting here don't know, federal workers are under attack today. But when we are under attack, we know how to fight back. Right? So thank you for the invitation on today. And someone asked, was this going to be like those town halls you see on TV? That's not the plan, that's for sure. You know, it's all about having a conversation and giving out information, isn't that right? So sisters and brothers and community members, we're here to send a message. Even though they're not here, we're going to send them a message anyhow. A loud and clear message to our representatives and on Capitol Hill, especially the representatives Carter, Williams, and Lugar. And that message is this: save the civil service and to save the country. I want you to know that all of you sitting here, you may not feel it right now that it's impacting you, but I'm telling you, like Dr. King said, we may have all came in on different ships, but we're in the same boat now. That's the truth. And so, as you all know, we have a pro-apartheid South African billionaire determined to do to the United States what he did to Twitter, turn it into an X-rated obscenity. Only in America can you be called a business genius when you just borrowed and spent $44 billion and lost 80% of it. Trust me, he's no genius. And we are threatened by a president who thinks he's a king. But I only know one king. I only know one king. And that's King Jesus. You know? Also thinks he's a mobster or a boss or something, but he violates the law and the Constitution without a thought. We ask you all to stand up to support and defend the civil service and the country on today. Use your voice to stop this president from canceling programs you authorized and funding you approved. We have to demand the executive branch to uphold every collective bargaining agreement in force, every single one of them. Members of Congress must support and defend the people they represent, support and defend their rights and freedoms, their health and well-being, their safety and security. And please remember this, nobody voted for Elon Musk. Nobody voted for this grant. Americans didn't vote to sabotage our veterans by cutting VA staffing, firing more than 80,000 workers, a third of whom are veterans themselves, will destroy the VA's ability to fulfill the PACT Act's promises to veterans who either died or became ill as a result of exposure to burn pits, Agent Orange, and other toxic substances. Most of these employees were hired explicitly to provide the benefits provided for in the PACT Act. The VA has been severely understaffed for many years, resulting in longer wait times for veterans in need. But they blaming the employees for it that are working there every day. The Dodge plunder of career VA employees, adding to the illegal mass firings of thousands of probationary employees, can only make matters worse. They didn't vote to make air travel dangerous, again, cutting TSA and air traffic control staffing, taking away the collective bargaining rights of those same TSA officers. We do have a TSA spokesperson for today from our Killeen Airport. Let's give her a hand. AFGE will not rest until basic dignity and rights of workers at TSA are acknowledged by the government once again. They didn't vote to put contaminated meat on supermarket shelves by firing inspectors. They didn't vote to get cancer from dirty air and water because EPA workers were all kicked to the curb. They didn't vote to fire the Labor Department staff who keep workplaces safe and make sure employers pay their workers. They didn't vote to put our warfighters at the mercy of contractors after they fired DOD civilians. They didn't vote for the dismantling of the Department of Education. Over 60% of Americans oppose this idea. The Department of Education plays a crucial role supporting our students and their families at schools and universities in every community across the nation. And President Trump's directive to eliminate this small but mighty agency would destroy our education system and devastate generations of students. We have a spokesperson also from the Department of Education. This executive order is nothing more than an illegal overreach and executive power designed to unemploy dedicated civil servants and disseminate the critical services they provide to millions of Americans across this country. And they sure as heck didn't vote to, quote, traumatize America's patriotic and heroic federal employees, 30% of whom are veterans. How many of y'all said y'all veterans out there? Yeah. Who is both less paid and more free than we ever get in the private sector in order to uphold the Constitution and serve the American people. So to our Republican representatives, we invited you here. We are asking you to uphold your oath of office. They're not here, but they're going to get this message. Don't put your conscience in a blind trust or check your spine at the door. Don't aid and abet a lawless, corrupt administration, hell-bent on destroying government's ability to serve the people. To our Democratic members of Congress, here in the great state of Texas, use every tool in your toolbox to put sand in the gears of Musk and Trump's assault on America. When the debt ceiling needs to be raised, tell them you will be glad to help them if and only if the Trump administration stops breaking the law. That means upholding all collective bargaining agreements, spending every dollar Congress appropriates, stopping all firings, protecting the civil service system, and getting Elon Musk's worthy paws out of our data. Use the power of the purse. Number one, defund Dodge. Go, whatever you want. Number two, defund the fat federal contracts that fund Musk empire. Number three, defund this administration's union busting and put our people back to work for America. They're asking them to have courage. This is what they need. Courage is what the moment calls for. How many of you know it takes courage on today? Because even with us speaking against this administration, they're ready to come against you just for speaking against what they're doing. But they might as well bring it on, because we're ready. So sisters and brothers and community members, let's stand together in solidarity with everything on the line. Let's speak out together, march together, fight together, rise up together. Together, let's get out there and tell our elected officials to stop the attempt of this coup. This is an assault on our democracy right now at this pivotal moment before it's too late. It's now or never, and let's make sure we can tell our grandchildren that when democracy was on the line, we answered the call. So I want you to know, when we fight, we what?
We win.
When we fight, we what?
Win.
When we fight, we what?
Win.
Now let's get out there and let's kick some butt.
Now, I know that was just a little bit hard to hear. You probably had to be in a quiet place and turn your volume up, but it was definitely worth listening to. Miss Eliano is a great speaker, very passionate about workers' rights for federal employees, and I don't blame her. I mean, she's been doing it for a long time, and this money. These positions, these agencies were created by Congress. They are funded, and I just don't see why members of Congress are just ceding their power to the president and not even challenging anything, just letting it go. And so it's definitely scary times with what is getting by. But, Beto said something in his town hall yesterday that resonated with me. And what he said is, we're either going to fight or we're going to surrender. And I'm going to fight. When democracy's on the line, you either fight or you surrender. Which one are you going to choose? I know I've already chosen. I'm going to fight. So, with that said, I want to touch on a subject that it's something I've been working on for several months, doing research, talking to people, going out in the community, visiting other areas to see where they're being successful, where they're not being successful. And especially now with everything going on in the federal government, proposed cuts to Medicaid, that's going to hurt. It's going to hurt our most vulnerable populations. And so let's go through a whole history of what I'm talking about, so you clearly understand the options. And like I said, this is just going to be the first episode where I talk about this. Though definitely going to be more opportunities for discussion, but this is going to set the foundation, so you know what the county is doing in the past, what we've been doing, and then the possibilities of the future. So let's go down this long but beneficial road, and let's start with our budget. Actually, before we start with the budget, let's look at some laws that apply. There's two things that apply for the indigent health care for a county. We have the Texas Constitution that requires it, and then the Health and Safety Code, Chapter 61. It really goes into the operations and the program benefits and services of a county indigent health care program. So those are the two laws that are governing the county health care program. So according to the statute, 8% of the total budget for the county, the general revenue budget, is dedicated, required, mandated by law to serve the indigent population of the county. There's a couple of caveats to that, that if you have a public hospital or a county hospital district, then those requirements go to those entities. But in Bell County, we do not have a public hospital or a county hospital district, so that is the county's responsibility to administer that indigent health care program. So if we look, there's a couple of things that the county does. So we have the Local Provider Participation Fund. That is a tax that the county is authorized to levy against healthcare, all healthcare in the county. So we do that. You don't see it on your bill, but the county levies a tax, a 6% tax on all healthcare in the county. And what that's supposed to do is authorizes the county is like a pass-through, and that tax that we give to the healthcare, to the hospitals, that comes to the county. The county sends it up to the federal government, and we get reimbursed, and it doubles, triples some of the money that comes in, and that's to help offset Medicaid, Medicare expansion that Texas did not do. So, and that LPPF, they call it, that's actually on the chopping block with this administration. They're looking at cutting that. So if they cut that, Bell County last year got over $180 million reimbursed to the county, given to the local hospitals to help offset the cost of what's called uncompensated care. So if you go to a hospital, they cannot deny you care. But we don't want people going to emergency room for care because that's the most expensive type of care. So, but anyways, that money helps offset that uncompensated care. So if someone goes there, don't have any insurance, that's how they're supposed to get some of that money back. It doesn't make them whole, but that's how it's supposed to get some of that money back, is through the LPPF tax. And that with the current administration, that's on the chopping block. Also, they're going to be reducing Medicaid. Those funds help our most vulnerable people get health care. And if they reduce Medicaid that and the LPPF, that's only going to strain services to the county, because we're required to, by law, to take care of indigent health care, the indigent in our county. So LPPF, indigent health care, 8% of the county budget, right? You're following me? And so what does the county do with that money? Now we'll kind of go into the budget a little bit. Uh, this year's budget for 2025, FY 24-25. Let me go to the page. One second. I believe it's going to be around, there we go. $160 million for total general fund revenue for Bell County. So the county gets around $10 million roughly to do our indigent healthcare program. So what does the county do with that money? Well, everyone in the jail, and typically our jail population runs around 1,150, somewhere in there, daily population. Everyone in jail by law is considered indigent. So all the health care in the jail is covered by the healthcare program, the indigent healthcare program. So just right there alone, and it takes half of that, $8 million, $9 million. That's going to change a little bit because we didn't budget for that. So we had, I think, $3 to $4 million budgeted for our healthcare program in the Bell County Jail. Our contractor that we had quit, canceled the contract last year because they said that they can no longer give us health care at the contracted price. So they canceled the contract. So we had to go out to bid. The bid that we received was double that, almost $10 million. So we're going to have to already raise taxes just to cover that additional expense for our health care that we didn't budget for. So half the money is already gone to the jail to cover those medical services in the jail. The other portion of the money, what is remaining, is what is spent in the community. So right now we have a indigent health care, administration, where our director manages all the claims coming in, onboarding people. There's requirements that you have to do to be a recipient of indigent healthcare services. So there are certain thresholds that you have to meet. Outside of that, there is like optional care, but I think the county has moved away for any optional care. So there's basic services that the county is required to provide, and outside of that, nothing else, unless we want to, unless we're gonna pay for it. The state is not gonna reimburse anything, and by law in the chapter 61 of the health code gives us that roughly $30,000 per qualified indigent person that is in the program. So $30,000 a person has to spend for their health care in a year. That's medications, that is appointments, preventative care. So just to give you an idea, what does the county do with that other portion of the money? The other half that is for the community. So we have two clinics, the Greater Killeen Community Clinic and the Temple Community Clinic. Those two clinics are, I believe, nonprofits. They operate on their own. They've been in existence for quite some time, both of them. And so the county partnered up with those two community clinics, and we give both clinics rough the same amount of money. We give them $500,000 each to help administer healthcare services for the county, indigent healthcare services. They're able to do it, a little bit cheaper, and it's been a good program. I think it's been doing it for about 5 years now, so it's been a good program for the clinics and for the county because we're able to see more people. The rest of that money that is left over, and I believe it's like $2 million, though that's for claims. So if there are, say you go to the Killeen Community Clinic and you need a specialty, well, that, obviously they don't have any specialties at the community clinic, so you got to get referred to one of the local hospitals. All these hospitals are for profit, or but they're private hospitals. They're not any type of public hospital. So we have Baylor Scott and White. We have Seton, Ascension. Then we also have the VA. We have not Metroplex, Darnell. So we have a lot of hospitals in here locally, and that's where some of that LPPF comes in, the uncompensated care comes in, and so what I'm seeing is that our need is starting to grow, continues to grow. The county is getting larger. Our budget is capped, so. And by each year, we can only go 3.5% above what we taxed the previous year. That's our cap. Above the no new revenue rate is what they call it. So the no new revenue rate is, the same amount of money that you got last year. Whatever that tax rate would be. So obviously, as your county grows and develops and gets subdivided, a lot of new homes are coming on the tax rolls. So in theory, you should be able to lower your tax rate, but still keep the same revenue because you have more developed property coming on board. So that's the no new revenue rate. We can only go 3.5% above the no new revenue rate before we have to do what's called the voter approved rate. So anything above the no new revenue rate, the 3.5% above the no new revenue rate, we have to take it to the voters. And, obviously it's going to have to be something compelling. I don't think voters are going to approve, hey, we need more jailers, we need more road money. Maybe, but we haven't done it here. I think the last one that I'm aware of that went above the no new revenue rate over the voter approved rate and went to the voters was Harris County, and the voters actually approved that. And there may be other counties that have done that. I just hadn't seen it in the news. And that's an option for us if that's what we want to do. But I do know that I don't think there's any appetite on the commissioner's court to gamble on the voters on raising taxes because people don't like to increase property taxes. So what would happen is if it does not get approved, a voter approved tax rate, then you're stuck at the no new revenue rate. So that's kind of the catch that we're in. With increased demand for indigent health services. But there's another option. And that's what I've been working on probably the last 6 months, talking with other agencies, other counties on how they do it. I'm still doing my research, but I think we have an option here that we could choose from in Bell County. If you remember, I was talking about county hospital district, and I think that's going to be our answer. I do see some disparity of services across the county, from the east side of the county to the types of services available on the west side of the county. And that's an issue. That's an issue. The level of service is not the same. The cooperation is not the same. Hopefully, we can address some of those issues. But as of right now, it is an issue that I see. Access to care, to the same level of care, to our citizens. It needs to be standard. The type of care that you get and support you get on one side of the county should be the same that you get on the other side of the county. And that's what I'm going to strive for. And I think that's what this proposal that I'm going to be bringing up would do. So what I'm talking about is a county hospital district. A hospital district is a taxing entity, but as I mentioned already, you're already getting taxed. 8% of our general revenue, which is taxes, is for indigent health care. So that would get cut off from the county and go to a new hospital district. Any type of public health, Bell County has a public health district, that would go to the hospital district as well. And then the jail contract, the jail health care, that would go. So those three things would all go under this umbrella of a hospital district. They also could do ambulance service. As of right now, in the west side of the county, there's a lack of ambulance service. We have to get ambulance service from Nolanville, and that's only if it's available. And that could be 30 to 40 minutes away for the Turnbow Ranch area, because City of Killeen said they're not going to go out and service Turnbow Ranch. So we have this county hospital district proposal. There are three ways that we can, and by we, I mean us, can create a hospital district in Bell County. The first way is Chapter 281 of the Health and Safety Code. That is hospital districts in counties of at least 190,000 people. Obviously, Bell County, we're nearing 400,000, and we would qualify under that section of the hospital district. It's going to require a vote. So the Commissioner's Court can either call for an election, or a petition can be given to the Commissioner's Court for the calling of a vote for a hospital district. This method would create a hospital district, taxing authority, and the board, the hospital manager district board members, would be appointed by the Bell County Commissioner's Court. A lot of the larger counties operate in this model. Travis County, they have Central Health. Harris County, they have Harris Health. Dallas County, they have Parkland Hospital. That's their health district. Bexar County, they have University Health. So all those large hospital districts operate in this manner. There's another way. We have Chapter 283 hospital district, and that's where it's still an election is called, but the board, the district, is the commissioner's court. The officers are the commissioner's court. So not much would change as far as who's making the decisions, but the taxing ability kind of goes off of the county's 3.5% cap. If you kind of understand what I'm talking about, that way, like I said, it still calls for an election, and the commissioner's court would call for that. I don't know if there's a petition for this model. I don't think so. I think this is just that the commissioner's court would call for it. Yeah. Or no, it says, or presentation of a petition creation. Okay, so in this model, it could be done the same way, either by petition or by the commissioners calling. The other way, the third and final way, is Chapter 286 of the Health and Safety Code. And this is titled Hospital Districts Created by Voter Approval. So in this model, and it is out in some other counties, Midland County for one of them, for instance, they have a hospital district and all their board members are elected. So they would be elected. This one has a little bit higher threshold. So the commissioner's court can call for the vote, call for an election, or a petition could come in with 3% of the total registered voters in the proposed district. So, for instance, in Bell County, that would probably be about 7,000 signatures. And then we would have to call for an election. Doing it this way, voters would vote on who the members of the district are. And they would be elected during the same time that you do elections for city council and school board races. So those are our three options to create a hospital district. Let's keep in mind the hospital district will be a taxing authority. You are already getting taxed for indigent health care. So it's not like it's going to be additional money out of your pocket. It could. I'm not going to lie and tell you that it wouldn't. And what I mean by that is, so if the county is already taxing you 8% and a hospital district is created, that 8% goes to, and by 8%, I mean the actual dollars that were levied would go to the hospital district. The county's tax rate is still the same. So you would expect for the county to lower its tax rate accordingly 8%. So that is just something that you're going to have to be mindful of to the elected officials to let them know that, hey, if we support a hospital district, then we expect our county tax rate to be lowered. And that's something I would support. Are there a lot of needs out there? Yeah, there are a lot of needs out there. But we need, especially with our cuts that are coming to Medicaid, our cuts that are already happening to SNAP, to VA, there's going to be a lot of need and the LPPF getting cut, we're going to have to step up and be able to take care of ourselves. And I think this is a good answer. It's a good start. Like I said, there's a lot of hospital districts out there. This would not be a new or novel approach to helping out the needy. Our largest counties in the state of Texas has a hospital district. Our smallest counties in the state have a hospital district. And now it's time for Bell County and its residents to have a hospital district to take care of our most vulnerable population. So that is what I plan to bring to the voters in November of 2026, a hospital district. And it's going to be up to the voters to decide if that's something that they care about. Is that something that they can support? They're supporting it now with their taxes. And I think that the people of Bell County will step up to the plate. I think they will vote for a hospital district. And I'm looking forward to going out and telling people the benefits of the district and what we have now and how it will improve lives, save lives, and save money during the process. So anyways, I got to pack, get ready to go. Enjoy your day, and we will talk to you next week.